In our recent videos, we talked about the consultation, we talked about the patient reported findings. Now let's talk about finances. The number one reason why a new patient will never come into your office is because of the cost. The number one reason why a current patient, an active one, will terminate is because uncertainty of the finances. So dealing with finances is very, very important. It's recommended that in the majority of cases, and there are certain cases you can't, such as Medicare, that you do some sort of a package, just like a dentist would do. In other words, what you want to do is ballpark the entire, or shall we call it a case fee. You want to ballpark the estimate of the entire care, what it's going to cost them. Let's say, just for grins and for this illustration's sake, that it's $1,800. So what you want to do is you want to let them know that the care is going to be $1,800. You want to do comparison and contrast whenever you're explaining this. For example, explain to them that $1,800 would cover about an hour and a half in the average hospital. So you want to let them know that this is going to be about 8 to 10 months worth of care for the same as about a half a day, if that, in the hospital. Do a comparison and contrast. Or, you know, if you go in and you get braces from a dental office, that's $4,000. That's $4,000 for braces, just for straight teeth. We're talking about your spinal integrity, your nervous system, and it's well under half of that for 10 months. So you want to do comparison and contrast so they can kind of get a feel of what a great value this is. Then, as I mentioned, you want to ballpark the case. In this illustration, we're going to use $1,800. Let them know if they pay for that up front in full, MasterCard, Visa, check, whatever, you'll give them 20% discount, which takes $200 right off the top of that, or whatever that comes to, $200–300. That way, if you get it taken care of up front, you don't have to worry about the finances. They can take advantage of a significant discount. And the other side benefit to you as a chiropractor is these people rarely miss their appointments. There's the hassles, the financial factor, the reasons, the excuses are all done out of the way. Now, if you do it that way, you'll find that about half of your patients will take advantage of that. Now, the ones that don't, I recommend you split it up over 4 months, where you deposit a credit card or however you want to do that. I recommend you keep that on file, debit it at the beginning of each month. And if they do it, spread it out over 4 months, give them a 10% discount off the top. Now, you'll find that if you do that, 75% of your patients will take those 1 or 2 options. Now, when you're giving options, only give them the first option first, so they think that's the only option. And if they say no, then give them the second option. And the third option is obviously to pay as they go, which financially is going to cost them significantly more. So you want to do comparison and contrast, show them the value. You want to do a case fee, give them a first option, then a second option, and then pay as they go option. But another important point as far as case fees go, and this is a sticking point with most state boards, what tends to happen is chiropractors collect the fees up front, and if a patient wants to cancel, the chiropractor spent the money, they don't have the money to give it back, they argue with the patient, yada yada. What you want to do is you want to make sure that you keep these fees in a separate checking account, and you only draw against them when you render the service. Second thing is if a patient cancels, don't play games with them. Obviously you want to try and keep them under care, but refund them the unused portion of the monies. That's important. Those are the top 2 ways where you're going to get in trouble with your state board. If you do that, you'll find it makes your life so much easier by giving these options of case fees and divide it either into Section 1, Section 2, Section 3.